Iedereen weet wel wat het is, times 3. Hoe zou je deze behandeling het beste kunnen... Wat is het probleem eigenlijk? Wat is het probleem van schemen?
In de huid.
Is een
scheur in de huid.
Een scheur in de diepe dermis. Dus we moeten eigenlijk tot de diepe dermis geraken. Hoe geraken we tot de diepe dermis? Niedelen. Laser. Eigenlijk moeten we zorgen dat we eigenlijk een diepe warmte krijgen van onderin, die eigenlijk geleidelijk aan terug naar boven kan groeien. En dus we gaan die collageenstimulatie doen met warmte. Wat is er nodig voor collageenstimulatie? We moeten een temperatuur hebben, van 55 tot 70 graden. En welke therapie gaan we gebruiken? Wel, microneedling is weg, dus microneedling met radiofrequentie, geen coagulation, want anders zou iedere diabetespatiënt die hem dagelijks 5 keer prikt een prachtige buik hebben. Vandaar dus Genius, lasertherapie, Pico Plus, ook om de structuur van buiten op te verbeteren, en de Hollywood Spectra om een lange puls, om in de diepte die warmte te krijgen. Kan ook eventueel met een kleintje gebeuren, maar het is vooral dat je eigenlijk een temperatuurverschil in de diepte moet hebben. Waarom moeten wij een needling met radiofrequentie doen? Ook omdat die breuk in de diepe dermis, die is volgroeid. Wij moeten die terug beschadigen, omdat er terug zouden brugjes gemaakt worden. Ik zou... Ja. Dus dat is... Ja. Hier zie je dus eigenlijk hoe kunnen we nog eventueel de total skin rejuvenation doen. Dus microneedling eerst van in de diepte werken. Daar gaan we zorgen dat we dus een thermisch letsel, een gecontroleerd thermisch letsel maken. En dan gaan we de ultra, die een thuliumlaser is, die gaat ervoor zorgen dat er een vaporisatie van de waterhoeveelheid aan de oppervlakte gevaporiseerd wordt, zodanig dat er eigenlijk een trigger is, zowel voor epidermaal als dermaal nieuwe huid te maken. Ja. En nu laat ik het woord aan.
Okay, so as it was introduced, my name is Narpan. Can you hear me okay?
Yes.
Okay, so I am a product manager of Lutronic. So today I'm going to talk about Genius, Ultra, and then prior to therapy. I supposed to reduce the short of the presentation yesterday. I drank a lot of Belgian beer yesterday. Really good beers. I couldn't resist. Anyway, I can go fast, but if you have any questions during the presentation, you can of course welcome to ask any questions. So I will start with Genius. I think many of you are already familiar with this device. Then I will move on to the Ultra, because the reason why I talk about these two devices together, because these two devices is actually really good combinations. So I will explain why. So firstly, I want to talk about the why Genius, and then I mentioned this device in terms of the anti-aging skin solution. There are many anti-aging skin solutions in the market, but when people talk about Genius, they normally talk about the tightening, lifting, or skin texture improvements, and so on. But in general, we can call it as an anti-aging treatment. But when we are thinking about anti-aging treatment, what it actually means. So that's the question I like to ask, and then that's the reason why we think the Genius is the real anti-aging solution. So this is just examples that to talk about what people really want. So maybe those patients, this is not a bad endpoint if we are treating with a CO2 laser, which was quite popular in old days. But now people want to have a good result with no downtime. So that's the problem. And that's a problem to us, to our company, because we need to make a product that's as good as a CO2 laser, to back then, also has the minimum or low downtime. So that's the homework for us, and then that's the why the companies keep making the good products to fulfill those needs. So that's not what we want, but we want to have this really good result as well. So how we can achieve those results? So before we answering the question, what is the skin aging process? So these questions that we all know, but let's take a look at what's the skin aging process in more detail. So skin aging process is going from here to there. It's very simple. But when we are looking at the some more elements of the skin aging process, it can be summarized in some factors. So for example, like 50% reduction in collagen elastin content in late 30s. So our collagen elastin is reducing as we get old, and once we get to late 30, we only have 50% of collagen components. But it might be depend on people's the condition and also the genetic condition as well. So as we are getting old, this is some graphics shows that this is a young skin and this is the old skin. And then one of the things that we can notice is that, of course, the collagen and elastin is reduced, and because of the reason, the skin thickness also reduced. So that's the thing that we can notice when we get old, and that's the things that we can take as an element when we talk about the skin aging process. So these are just brief summaries of the skin aging process. So one is that, of course, the collagen elastin is reduction. That's the skin aging, one of the key element of skin aging process. And the skin elasticity reduction and skin sagging is different, which means that once you get people old, because of the gravity, your skin gets dropped because the skin elasticity is reduced. And also, as I mentioned, the skin thickness is also reduced. So when we are thinking about those things, then we can think about what is the anti-aging the process. So anti-aging process is going backwards from here to there. But of course, it's actually impossible to go from here to here. But we can, when we are thinking about the elements of the skin aging process, we can improve those elements. That's the skin anti-aging solution that we can think about. Which means that collagen elastin bundle need to be increased. And also skin elasticity increased, and skin sagging needs to be improved. And also, very important, skin thickness needs to be thickened, which means that once we get old, the skin thickness gets shrinked. But as an anti-aging solution, the skin thickness needs to be increased. So those are the key elements, I would say, for the anti-aging solution. So then, when we are thinking about all the options we have right now, and then we can question whether those options are the real anti-aging solutions. So let's take a look at some of the options we have. So very obvious option is, of course, the facelifting. Facelifting is a very dramatic change of the looking. But when it comes to think about these facelifting options in terms of the anti-aging solution, and then with those elements, facelifting is to improve the skin sagging by manually or physically lift the skin up, but it doesn't improve the skin condition or tissue condition because it doesn't increase the collagen and elastin, and also it doesn't increase the skin elasticity. But if people want to have a really dramatic change by physically lifting up the skin, then this would be a good option. The same thing for the thread. Thread might be the case. It may have some effect to increase the collagen, but many of the doctors, they mentioned that it doesn't really have a big impact. Even for some doctor medicine, maybe it doesn't have a no effect for increasing the collagen bond. So same thing for the facelifting. It has impact or improvement on the skin sagging, but more importantly, it doesn't really affect increase the collagen and elastin. And ultrasound, as an example, like a Uthera. So that thing is different because the Uthera, I will mention later, is to increase the skin collagen by having some thermal effect into the skin. But the key difference or the key factor for the ultrasound is that it's not intent to increase the elastin, the bundle in our skin. And it can improve the skin, it doesn't improve the skin sagging, and more importantly, it doesn't increase the skin thickness. It actually shrinks the skin thickness because if you're using ultrasound, it may affect the fat level, the fat layer of skin, that actually reduces the skin thickness. So that's the one factor of the ultrasound. The other technology that we have is monopolar RF. Just the most popular one is the Thermage, as you all know. So Thermage is a different technology. It's also the ones that actually deliver the thermal damage into skin so that it can increase the collagen bundle in our skin. So it improves the skin, condition in terms of the increasing the collagen. But there is a certain factor that we need to increase the elastin, which monopolar RF cannot do. So I will explain later. Also, it can increase the skin elasticity because it increases the collagen bundle. But since it doesn't really improve the elastin bundle, that's why it doesn't really improve the skin sagging. Somehow it can also increasing of the skin sagging, but the very important factor to improve the skin sagging, we need to improve the elastin on top of the collagen. So that's the factor for the monopolar RF. And then the important factor again is the skin thickness. So monopolar RF, the same thing for ultrasound. If you're using monopolar RF in a very high energy, it also affects to the shrinking effects. So that's why many of patients they are suffering from the side effect from those technology, because what they want to have is to increase the skin thickness, but they're getting an opposite result sometimes. But those technologies are not bad technology. Those technologies are really good technology, but their target is a difference. So if I can highlight some of the factors, so those factors, increasing elastin and increasing in skin thickness, those factors actually are the ones that really not easy to achieve. Oops. Because when we are talking about anti-aging solution, real anti-aging solution, we need to fulfill all those factors. But as we are thinking about those two factors, especially for the increasing elastin and increasing skin thickness, there is no good solution in the market actually to fulfill or to be a real anti-aging solution. Okay, so this is actually she's a 77 years old female. So she wants to improve this area and of course an entire face area. But to be able to increase her skin condition, we need to have those factors. Improve the collagen, elastin, and the sagging, and also increase the skin thickness. Because her skin is get old, and then her collagen bundle as well as the elastin bundle is reduced. That's why she has a sagging skin. So why do sagging wrinkle occur? These are the mainly two factors for this sagging skin. One is the reduction of collagen fiber tissue, which decreases the skin tissue elasticity due to the reduced collagen. And the other factor which is important is the reduction of the elastin. So the collapse of skin support layer due to the decreased elastin. So what elastin work is that it's supporting the pillar in our skin. So if when the elastin is decreased, that's the reason why we have a really the sagging skin, and that's the reason why we are also showing the decrease in skin thickness. So how can we improve both elastin and collagen? So that's the question that we actually had when we developed the Genius. And then one very important factor is that we need to be able to target not just the upper dermis area, which is a papillary dermis, but also the reticular dermis area, which is down below the very deep layer of dermis. Because many of the elastin bundle is located in the reticular dermis. Some of them located in the papillary dermis, but many of them is actually from the reticular dermis area. So that's the reason why it's very, very important to not only the papillary dermis area, but also the reticular dermis area. So that's the starting point of Genius. And then actually many of the microneedling RF technology, they don't realize its importance. So we take a look at, of course, there's some studies about this area. We also notice that there is also a very important factor to increase both collagen and elastin. The one factor, as I mentioned, we need to be able to target the reticular dermis area. And the other factor is that we need to be very accurate in terms of the temperature for creating a coagulation zone into the skin. And the accurate temperature we need to have, we must have, is between 60 and 80 degrees Celsius. That's the damage temperature that we want to have to increase the collagen and elastin into the skin. However, it is not easy to control the exact depth. That's one condition, because in order to achieve or target the reticular dermis area, which is deep down below dermis area, the laser or monopolar RF, this is a monopolar RF as an example, it starts from the superficial area. So if we use a really high energy, this superficial or epidermal area is the one that actually get burned or some side effects. So that's why doctors or estheticians, they need to be careful to treat the skin. So they also want to avoid any types of side effects. So they're mostly targeting this papillary dermis area. And the other important factor is that the temperature level of a monopolar RF is mostly 55 degrees Celsius or below. So there is a effect with this temperature level. This is bulk heating from monopolar RF, and then this is from this temperature we can have some collagen denaturation effects, but it's not really the collagen or elastin increasement. But when we're using the ultrasound, the target temperature for the ultrasound is mostly above 80 degrees Celsius. And then, of course, we can choose the different transducers to target different depth. But since the temperature level that it creates into the skin is above 80 degrees Celsius, it doesn't have the coagulation that we want to have, and that's the reason why it doesn't really affect to increase the elastin into the skin. So as we are looking at those options, we don't really have the good options when it comes to real anti-aging treatment. Because one factor is that we want to target not only the papillary dermis area, upper dermis area, we also want to target it down below the reticular dermis area. Okay, so and then how we can create the coagulation into your skin. So let me briefly talk about how the RF energy create the injury zone into skin. Oops. So when electrical current or electric energy is delivered into the skin, let's say we are using the 5 wattage of the energy, and then we create this amount of the coagulation zone. And then we can think that as we increase the energy, the size of the coagulation zone can be increased. So that's what we can automatically think when we use the radio frequency energy. And then this is what we're supposed to have. Because as we increase the energies, then our purpose is to increase the coagulation zone, the size of coagulation zone, so that we can have a more collagen, neocollagenesis effect and neoelastogenesis effect to increase elastin and collagen. So this is like a perfect, or this is what we want to have. But in reality, this is what is actually happening. So this is what we can see with ultrasound technology. And then this is just regular microneedle RF technology. And this is the one that we can see with the Genius. The big difference is that we cannot increase the size of the coagulation zone. So that's a huge difference. The reason is because of the temperature. Because if we have the temperature level between 60 and 80 degrees Celsius, and then we can control the temperature, then we can actually manage the size of the coagulation zone. But if we cannot reach those temperature, it doesn't really increase the size of the coagulation zone. So that's the key factors to have a real anti-aging solution. And since there is a big difference in terms of the size of the coagulation zone, it also leads to the effects wise as a result. So this is the injury zone, the coagulation zone that we can have with Genius. So you can see that as we're using 20 milliliters per pin, 40 milliliters per pin, and up to the 100 milliliters per pin, we keep increase the size of the coagulation zone. So this was the intention that we wanted to have, and this is actually the reason why we developed Genius, because this is the ones that actually increase the collagen elastin, and this is the one actually we can actually have a real anti-aging solution. So I think I just jumped on the conclusion, but the Genius is the one that actually achieved the real anti-aging solution because it controlled the temperature through the impedance control, and also because of the needle, the very fine needles and quality of needle, it can reach the retrodermis areas. So as we change the depth level of the treatment, very important factor is that we want to target the retrodermis deep down below our dermis area, and of course the papillary dermis area, so that we can treat the entire dermis area in order to have a new collagenesis, new collagen generation, and also new elastin generation. Okay, so this is some of the before and after photos. I will go quickly. Baseline and after 3 treatments. So these are the ones that we want to have, because these people, this person is the one that actually their collagen, not only the collagen bond, but also the elastin, the pillar is destroyed as she get old. And same thing for this patient as well. So in order to treat those patients for having a really good tightening lifting effect, we need to be able to target retrodermis with a certain temperature. For the patient, the same thing. And acne scar as well, one of the very popular indication that we can treat with the Genius. So as we're using Genius, of course, the many of the the doctor use the Genius for the lifting and tightening effect, but acne scar is very, very popular, and we are showing really good results because it creates a new collagen elastin. As a result, it will also treat the acne scar. For darker skin type patient, this is the colorblind treatment because we're using the RF radio frequency with needles. The acne scar for darker skin type patients. And the very important or interesting factor is that it can also treat the burn scar. So the burn scar is very, very interesting case because the skin characteristic of the burn scar is very different from normal skin. Normally it's a very dry skin, which means that when we are delivering the radio frequency energy, it doesn't really deliver the energies because the skin impedance of the burn scar is normally is very different from normal skin. So that's the reason why the radio frequency energy doesn't really deliver the heating into the tissues. But the reason why we can treat the Genius is because of the technology we have. I will go briefly of the technology. But very important takeaway is that Genius is measuring the skin condition of the patient, and then it delivers the energy based on the skin condition of the patient in real time. So that's why we can deliver like a burn scar or the other scar, because the Genius is measuring the impedance in real time, and then it adjusts the power to deliver the correct amount of energy based on the skin. Okay, so I think I skipped the technology part, but as I go through the Genius and the Ultra, I'll go briefly and talk about why Genius works for this burn scar patient as well. So as I mentioned, Genius is the ideal solution that we want to target the dermis area. Then what about the epidermal areas? Because we also want to target, there is a benefit of treating the epidermal area, and then that's where we can treat with Ultra. So the previous model we had, the Laser D, that's a good device as well, but we also wanted to improve the quality of the treatments. So that's why we also developed the Ultra. So this is an injury or coagulation zone that we can have with the Genius on the right, and then this is the injury zone that we can have with Ultra. So you can notice that by having Genius treatment, we can treat the dermis area, retroepidermis and papillodermis area, and also by adding the Ultra, we can also treat these areas. But as I mentioned the very important factor for treating patients in these days is to have a really good effect with no downtime. So, but for treating like epidermal area especially, if you are really like using a high energy with other methodology, it comes with long downtime or sometimes side effects. So we want to control the downtime, and also we want to have really good effects. So that's the goal that we want to have. And then that's where the 1927 nanometer wavelength, which is a Tudum laser, it played a really important role. Because as we're using the Tudum laser, it has a minimum downtime, and then we can have a really good injury zone in this upper layer of the dermis. So that's why we can have a really good effect and also no or minimum downtime with those two the technology. So I mentioned that about the technology we have for Genius. One of the key difference is that is the needle quality. So needle quality is very important to reach the accurate the depth of the skin, because when we actually push the needle into the skin, we are not actually pushing the one needle. We are actually inserting like a multiple number of needles at the same time. But as we're doing that, it actually requires a huge amount of power to push the skin and reach a certain area or certain depth into the skin. So, and then the things that we notice is that the needle sharpness and also the needle quality on the surface plays a very important role. And that's the reason why actually we looked around the company who can make a good quality of needles, but actually we couldn't find any company in the world. So that's why we actually decide to make our own needle in our company, and then right now we are the one actually we make our own needle in our company. So that's also the difference from the company. Okay, so this is just the videos. So we set the 2.5 depth, the same depth for all the competitors, ours. Oops. So you can notice that this one doesn't really penetrate. This is actually a very popular device that has been sold in the market. And then this one, although it's better than this one, but this is also a typical reaction in the skin. It creates a gap between the top of the tip and the skin, which means that the actual penetration depth is not like a 2.5. It will be like a 1.5 or 1 millimeter depth. So to reduce this gap between the skin and the tip, we need to have a really good quality of needle. So that's why we decide to make our own needles. And the needle sharpness, also needle refinement, plays a very important role. The other important part is the impedance energy control. And then, as I mentioned, the skin condition for each and everyone in this room is very different, and also for one patient, one person, depending on the location, the impedance or skin condition is also very different. And even for that one location, depending on the depth of the skin impedance is also very different. So, in reality, it's actually impossible to pre-know the skin condition and treat the correct amount of energy, because our skin condition is very, very different, and depending on the environment, if it's wet weather or if it's dry weather, skin condition also very change. So, ideal solution would be is that it measures the skin condition in real time and control the energy in real time. So that was the initial point that we want to have, and that's the actually we decide to develop a new device from infinity that we used to have. And as a result, we can have this pure the collagen, the volumized collagen, the coagulation, and as we increase the energy, we can expand or increase the size of the coagulation. This graphic is showing the impedance change during treatment. So when the thermal damage is created into skin, the impedance is dropping in our skin, and once it goes into this plateau, the graph, our impedance, this is the area that we can expand the size of the coagulation zone. And once it reaches a certain point, and then it changes the slope of the impedance, this is the area that our skin condition, the hydro condition inside the skin, is dramatically changed. So we call it as a desiccation. The desiccation means that the water component in the skin is dried out all of a sudden. And once that happens, it doesn't expand or increase the size of the coagulation zone. So our goal is to control at this point so that we can just keep maintain the same amount or equal level of the impedance so that we can increase the size of the coagulation. So that's where the impedance control system plays a very important role. because as we are reading the impedance in real time, and then we can notice, the device can notice this impedance change, and then once that happens, device change the power, the control, so that we can just keep increase the size of coagulation zone as we notice the disputes. So this is how the Genius works. And this is the reason why, so as I showed before, as an example, like a burn scar patient, the impedance level is very, very different. It's normally very high. So, and then as the device measuring the impedance of that skin, and then it controls the power, so that we can deliver the correct amount of energy to the burn scar as well. So we have different the tips, different the size of tip for different purpose. So M49D tip is the 2x2 size of tips that can normally we can treat for the body, but we can also use for the face as well. P14D, P16, or G49D. This is the one that we firstly developed, and then we move on to the next page. So this is a video that shows how we treat. I think many of you are already familiar with this one, but if we compare with the other microneedle RF, one thing that you can notice is that the most often time it bounces up. The handpiece bounces up because it creates a gap between the tips and also skin. That's why we cannot have accurate penetration depth. Okay, so as we are using Genius, we treat the dermis area, and then what about the epidermis?